Welcome to EllieMD's live educational series. Thrilled to have you join us as we continue our mission to help people live longer, healthier lives. At EllieMD, we go beyond telehealth. We provide education, community, advocacy, and an innovative healthcare solution to support your journey to wellness. Today, we're excited to introduce Sally Sykes, founder of Empowered Health Consultants. If you don't know Sally, she's an expert in functional medicine with over 15 years of experience helping patients optimize their health. After reversing her own type 2 diabetes and losing her father to Alzheimer's, she shifted from law to health coaching. Sally specializes in addressing root causes like insulin resistance, weight loss, hormones, and so much more, with a particular focus on supporting women through perimenopause and menopause. We love that. Well, thank you, Sally, and welcome. Welcome, welcome.
Thank you. I'm so glad to be here. These are always so fun.
I know we love having you here. But before we get started about talking about all these wonderful things, I love when you share your story of how you transitioned
Aw.
from law to functional medicine. If you could share a little background and story for anyone who doesn't know you, and then we'll get started and all the good
Okay.
stuff.
So, I grew up in Austin, oldest of four kids, went to college. Then I was like, oh, I guess I'm good at writing. I'll do law school, became a lawyer. Then all of a sudden, my dad gets diagnosed with Alzheimer's disease. I get diagnosed with type 2 diabetes. At that point, I'm married with children. I'm not practicing law anymore. And I realized that having type 2 diabetes doubles your risk of dementia. My dad was dead at 67 of dementia. And I'm pretty sure he had undiagnosed diabetes. He had visceral fat. He was a smoker. We ate the fat-free 80s, right? The candy corn is a health food because it's fat-free. And it was a terrible diet that we were told to eat in the 80s. So I switched my entire career from the law to functional medicine after I read this book called The End of Alzheimer's by Dr. Dale Bredesen. And in it, I found basically he lays out a dementia prevention program that includes optimizing your health in all these different areas, right? Insulin resistance, hormones, thyroid, nutrient deficiencies, inflammation, infection, all these different things. And he has this nice little table in here that shows you his optimal ranges for all these different labs where he wants you to have your labs to prevent dementia. And I was like, well, these are real different from the normal ranges that are in my labs, right? You get labs done, normal range, but you still feel like garbage, right? And your doctor looks at you like you're normal for the average sick American. So I did a little digging and I realized these normal ranges are just the averages of all the usually sick people getting those labs done at that particular lab. So as the American population gets sicker and sicker, these normal lab ranges get sicker and sicker. So he is using optimal ranges for preventing Alzheimer's disease, dementia, diabetes. And I was like, I want to know all the optimal ranges for all the labs because I want to be optimal. I know more of this normal business, average business. So I'm Googling, right? Go to Google. Where's the list of all the optimal ranges? It does not exist. So I was like, well, I guess it's up to me. I'm gonna make it. And so now I have my own spreadsheet of every lab you can think of with all the various normal ranges because they vary by lab and they've changed throughout the years as we've got sicker and sicker. And then the optimal ranges that functional medicine has found through various studies and books that I've read by MDs and various medical practices I've worked with personally and the ranges that they're using to get results. And so I use those ranges to help my coaching clients and learn how to analyze their own labs so that when they walk into a doctor's office, they know what to ask for. They can say, no, I don't want to be normal. I want to be optimal. There's a reason I feel like garbage. I can't lose weight. My hair is falling out. I have no libido. I'm exhausted and depressed and anxious, right? Don't just tell me I'm normal and send me out the door just because I'm beyond childbearing years. I have a lot more to contribute to this world. And so that is my super passion because I feel like we're great at women's healthcare when we're young and helping us have babies. But boy, over 35, it's like, bye. And I'm not okay with it. I'm not. And so I love educating women so they can get the best out of the healthcare system they're already paying for. And I get really fired up about it, as you can't tell. So
Oh,
I've been doing
I
that for
love
20
that.
years.
I
So,
love that because that's what these circles are about. I'm going to call
yeah.
this advocacy circle. We
I
talked about it
know.
briefly, but That's what I mean. You can't wait for the healthcare system to advocate for you. You have to become your own advocate, and then from there, help your community rise.
Exactly right.
Thank you for sharing that. And isn't it wild that because it's based off of a sick population at that, for example, if you go to Quest Diagnostics, so it's like if you live in a sick community, you're going to just continue to decline and get sicker. That blows my mind.
Right.
And it's just wild the way that the healthcare system's been created and we're continuing to evolve. And it's, gosh, it's like when you fall into that algorithm, it's hard to get out.
Yeah.
Now touch on your own diabetes and your
Yeah.
own diabetes journey and how you were able to reverse that.
So I was one of those patients that didn't really get caught because I was one of they call TOFI, thin on the outside, fat on no, thin on the outside, fat on the inside. So I had fatty liver, I had frank type 2 diabetes with a fasting blood sugar of 250 and over. Um, but it wasn't showing up. I was still kind of within the normal weight BMI for my height, which is 5'1", but fluffy for me, but no doctor was catching any of it. And so it really wasn't until I started monitoring my own blood sugar that I started to say, this is a problem. Like this, my blood sugar is all over the place. So I had to address it. Um, and the way I had to do it 10 years ago, we didn't have semaglutide or tirzepatide, or we may have had some other iterations of GLP-1s that were available before, because we have had GLP-1s for about 20 years now, but nobody was offering them to me at that time. And so first thing I did was go keto, which was very difficult to maintain. If anybody has tried that, it does work beautifully for reversing type 2 diabetes, but I don't recommend it for most of my coaching clients, especially women, because I feel like it's a little bit hard on our adrenals, and can affect our hormones. I had a little hair loss with it, but it definitely got my blood sugar into check. And then I transitioned to low carb, about 100 total, not net carbs a day. And I focus on high protein, high good fat, nutrient dense, anti-inflammatory foods now. And I've maintained the reversal of the type 2 diabetes for about a decade. And incidentally, without trying, I think I lost probably about 10, possibly even 15 pounds of just random abdominal weight that my doctor said, yeah, that's what happens when you have non-alcoholic fatty liver disease. Is so embarrassing. She was like, your internal organs have marbled due to excess carbohydrate consumption. And I was like, I don't know what you're talking about. You're very rude. Like, this is how we were told to eat, you guys. Don't you remember the food pyramid? It was the bottom. We were supposed to eat like baguettes, pasta, cereal, crackers, waffles, right? That's health food. That's what we were told. I was following instructions on the pin pad, and it did not work. And so now we're all very sick, and we're trying to reverse the damage. So if I was in that position, the same position now that I was, I would grab a microdose of a GLP-1 in a heartbeat to help me, because for me, and this is not the case for everybody, I had a really serious sugar addiction. I was like hiding candy corn in my bathroom, or what else was it? The frosting, cake frosting, those things with the Betty Crocker cake. Yeah, that with a spoon in my cabinet in my bathroom. Like that's, you have a problem when you're hiding it. That's a problem, right? It's just so bad. So I really had to get control of it. And for me, it has been like an addiction. Like I can't just have a little bit of heroin, right? On my birthday, I do better if I just don't have it. I do the abstention formula, but that didn't happen over Thanksgiving. So I'm still clawing back from it's like the spiral of addiction comes back. So I'm just like, no, okay, you can have the sugar by playing mind games with myself, but just have your protein first. Have your protein shake and your salad and your chicken, and then you can have the sugar. And by that time, if I fill up on protein, I'm usually full enough. But oh, I love you guys. Y'all are so sweet. Y'all are
Oh,
so
it's entertaining. All
ah,
right. But I love that you speak from personal experience. It's just, it is
well,
what it is. And so many of us suffer from the same thing
I
that,
mean, it's embarrassing. But
yeah.
it's true. And I'm sorry. I'm 51, and at a certain point, like we women have to stick together, and we have to be honest with each other. Like all this business of being on, social media and like trying to be like more perfect than each other, and just pretending that we have white knuckled this. Like I just know, like it
Mhm.
is a lot of hard work, and I had a lot of good support. Um, when I finally found functional medicine, that is. So yeah, Little Debbie's. Oh yeah. Do you want to go? It's in the interest of full disclosure, I have had some assistance, some cosmetic assistance on my And
Guys, if
would
I
say,
told you her age, by the way, you would not. She looks like she's 27. And
y'all are so
when you
sweet.
meet her over on camera, she's do you want to disclose your age? Is that rude?
No, I think I already said I was 51. Yeah.
You
So
go.
all
Okay.
very sweet doing that.
That's
So
very good.
if anybody's, because I think we want to talk about hormones and
Yeah, so let's get
thyroid
to it. Let's do
and
it.
loss and all the things. So this is the age, where it's like after the age of 35, this is when perimenopause starts and no doctor is telling you. This is that age where you go to the doctor and you have all those vague issues where you don't feel like yourself, like you can't sleep, you're fatigued, you're putting on weight where you never did before, and you're doing like the diet and exercise that always worked in your 20s and it's not working anymore all of a sudden. And then like your hair falls out and your libido's gone and you're not sleeping and all these different things. And your doctor's like, well, you're just getting older. Well, it's not helpful. And also, there are biological reasons behind those things, right? We start to lose the first hormones we start to lose in perimenopause are typically progesterone and testosterone. Progesterone is what we make when we ovulate every month. So the older we get, we're not ovulating maybe every month, even if we're still having regular periods. When we don't make progesterone, we can't sleep at night. Progesterone helps us get sleepy. It's also nature's anti-anxiety medication. So if you're having insomnia or anxiety, that can be low progesterone. Adding a bioidentical oral micronized progesterone prescription at night can be really life-changing. Um, and then testosterone. You want to get your testosterone checked before you supplement with testosterone. Because some of us, especially if you're insulin resistant, you might be dealing with what's called PCOS, which is rooted in insulin resistance, but ironically causes high testosterone in women and low testosterone in men. It's wild. But is one of the most common causes of infertility in women is PCOS. So if you're dealing with, a weight issue and you're in your 40s and you're wondering, oh, I should add testosterone to the mix because I want to build muscle mass, you might not need it if you're dealing with PCOS or issues with your cycle. Um, so getting that on board is hugely helpful. But as we age, we also lose insulin sensitivity, and that's where the GLP-1 compounds come in, and they are superheroes. We become more inflamed. We're less insulin sensitive. It's harder and harder to keep the weight off, especially around the middle, which has a huge impact on our risk for heart disease, you guys. And LEMD has got this right. Like you guys with the microdosing option as well as the weight loss option, like you're ahead of the game. And because this allows access to, I mean, everyone I love, I am telling about this. I'm like, I don't know, everyone should be on a microdose of this somehow. Almost every American, because 94% of us are metabolically unhealthy, overweight, obese, pre-diabetic or diabetic. So few of us actually are metabolically healthy. And the thing that kills us the most is heart disease, right? That's what we should really be afraid of.
So
And
can I quickly touch on that? Because so many fear mongers out there. Oh my God, the Ozempic face, the Ozempic butt, the muscle mass loss. And can you touch on all these fears that they play on and the disbenefits of GLP-1s? Can you touch on the benefits versus the disbenefits or anything that you do know about it?
I mean, there are just so many. So if you dig into the studies, what's really interesting is a lot of these potential side effects are dose dependent. So if you're keeping the dose low and slow, you're not raising your dose. If you don't raise your dose, if you have side effects, you only raise your dose when you're plateaued and you're not losing too much weight too fast. We're not, don't lose more than 2 pounds in a week. We can't really lose more than 2 pounds of fat in a week. So if you're worried about, muscle mass loss, it's not the peptide that's causing muscle mass loss. In fact, GLP-1s have been shown to actually have a muscle and bone sparing effect, you guys. So you take two different populations. You got one losing weight on, a ketogenic diet, just diet and exercise, and one on a GLP-1. That one on the GLP-1 actually retains more muscle mass. So in any weight loss process, you're going to lose fat and muscle in a certain amount, but you're actually going to lose a little less muscle if you're on a GLP-1, which is fantastic. And if you're working with an awesome coach who can explain, how to eat, get your protein goals met, at least 100 grams of protein a day, engage in weight-bearing exercise. I'm seeing my coaching clients put on muscle mass when they're on a GLP-1, right? So if these are done correctly, they can be really, really powerful. And again, so many of the side effects are dose dependent. So the standard dosing was developed for diabetics and it's appropriate for a lot of patients, right? And they can tolerate it. But having that microdose option is so critical because for a lot of patients, they might be already mostly metabolically healed, but maybe they're having trouble losing weight because they also have a thyroid problem, or they're in the middle of trying to figure out their bioidentical hormone replacement regimen with their doctor. That can take months to get that figured out because we're all a little bit different. It's so great to have a little microdose of a GLP on board to just stop the gain, and just calm the inflammation and allow your body to better take the hormone therapy if you're working on thyroid with your doctor too, and everything can work together really nicely.
Yeah. Can you touch on other peptides that we can use to optimize our health during middle age, especially? And then maybe talk about inflammation too while you're at it, right before you start this conversation.
Okay, so
Inflammation and then different peptides that we can use.
I mean, my number one anti-inflammatory peptide is GLP-1. So there's a great article. I don't know if I can share, I don't know if I can share screen, but I can put it in the chat. It's the article is called Glucagon-like Peptide 1, a multifaceted anti-inflammatory agent, and it shows all of the multiple ways in which GLP-1s are life-changing for the body. Let me pop back on here. So everybody go copy this, go read that article. There it is. And if you scroll down, it has this graphic that shows GLP-1 in the middle and all of the things it's doing for bones, heart, neuroinflammation, you name it, brain. But I mean, it's nonstop. It has so many effects. But as far as inflammation, I always say start with the basics, right? Like, let's stop throwing fuel. The first thing we're going to do as a health coach is we're going to stop putting fuel on the fire because you're going to be wasting your money on peptides and if fancy supplements, honestly, if you're continuing to eat garbage food, which I don't think a lot of patients actually on or people on this call are doing. Most of the coaching clients who come to me are already doing all the things. But every once in a while, I do get somebody who's looking for a quick fix and they just want to pile on peptides on top of Pop-Tarts and a bottle of wine every night. And I'm like, no, we can't do that. It's not a great idea, right? Especially with anything like growth hormone releasing. Like if you're eating a really high carb, high sugar, inflammatory diet, like you maybe have a cancer brewing. We don't want to mess with that. So we want to calm down the inflammation with a, low carb, low inflammation diet that is high in good fats and high in protein and high in micronutrients. The most inflammatory kind of foods are going to be like gluten and cow's dairy and alcohol. If weight loss is an issue, I always like to point out that one drink of alcohol stops fat burning for 12 to 36 hours. So that's a big one that patients who are on GLP-1s, they're just like, I'm not losing weight or I'm having excess side effects too. Alcohol can cause increased side effects on GLPs. They get rid of the alcohol or they lower it significantly. They feel a lot better and they get off of plateaus. Anti-inflammatory supplements that I love are going to be pro-resolving mediators. I love the one by Life Extension. Those are so powerful as anti-inflammatories. They're derived from fish oil, but they're used in the emergency room to combat cytokine storm in COVID patients. They are that powerful as anti-inflammatories. So they're one of the sort of fish oil anti-inflammatories that I love to use. Then, of course, we've got the glutathione and the NAD plus that you guys offer. And then a couple that I've been using for my shoulder injury when I lifted too heavy at an out-of-town gym without my trainer this last summer is a combo that you guys are about to start offering, right? The
Yeah.
Wolverine stack.
Mhm.
Okay, this is so great because if anybody is, 40s, 50s, I don't know what happens with our shoulders, but something happens and our shoulders just go rogue. And so this is what happened. I don't know, this one, and then it's sometimes this one, and sometimes it's a sleep injury or I was just sleeping. Why do I have a sleep injury now? But these two peptides, one BPC 157 has been around forever and ever, super safe, combined with another peptide called TB 500. And they'll call this, yes, I know, with the shoulder stuff. It's so annoying. These are when they're combined, you'll hear them called the Wolverine peptide, and that's because they are so amazing for healing. I had been using BPC 157 for a long time for the shoulder, and it had gotten 30% better. But when I read about TB 500 and I started adding that and stacking that with it, oh, I mean, I'm 90% healed at this point and was able to start lifting heavy again. Because that was the frustrating part when you get, shoulder injury, you're like, oh, I can't lift as I now had to go down in weights, and that felt sort of annoying and sad. You've heard about this peptide. Yes. So I don't want to go off on too many tangents, but this one is really, these two are actually some of the most well-studied, safe peptides out there. And, I say for any like shoulders, joints, anything like that, I think, obviously address the diet and lifestyle, go anti-inflammatory diet. First, make sure you're doing bioidentical hormone replacement to lubricate your joints, progesterone, testosterone, estradiol, all really important for joints and all that. And hips. Yeah, exactly. But then adding on some peptides like these can just take you over to the next level. And there's just so much data on them. They're just, it's been incredible. And so I'm glad this is something I just added the last 6 months, I think. Yeah. That I hadn't really done before. Oh, and then the other cool thing about BPC, and I'm going to shut up and let everybody ask questions, but BPC is derived from gastric juices. And so it also, besides the healing, it goes systemically and heals tissue throughout the body. It's also great for gut health. So I've seen it used concurrently with GLP-1 medications to reduce GI side effects. So if you're, we're about to, I know, right? It's one of the best combos. I love it. Also, it reverses ethanol poisoning, so it can help if you had a little too much alcohol the night before. It's so many.
Well, that's good to know.
Yeah.
These are all great stacks. I love that we're offering this, and it's a 1-to-1 ratio of the TB to the BPC. And it's amazing that your body knows exactly what to do with it, right? To deliver
Yeah.
it healing parts. I mean, gosh, that goes to show you the power of the gut. Now going back to the weight loss, a lot of people in their middle ages struggle with weight loss despite their best efforts. What are some of the most common factors that hinder weight loss during this stage of life, and how can they be overcome?
So we talked about the basics, right? We got to get rid of the garbage food. We got to get our sleep in gear. So if you have one night of poor sleep, even a couple of nights of poor sleep can make your blood sugar in the diabetic range, which can immediately stop weight loss. So really prioritizing sleep. I didn't know this. I've always been a night owl. We get all of our deep sleep before midnight, you guys. So if you're one of those people, I know the weight loss is so hard, Gwen. I get it. And so if you're consistently going to bed after midnight, even if you sleep 8 hours, you're not getting adequate deep sleep. So you're not going to be rested. Your cortisol is going to be higher the next day. You're going to have a higher blood sugar and it's going to be harder to lose weight. So prioritize sleep. I know in our culture, this hustle and just, especially women, we're supposed to be doing everything, making Christmas magical, working full time and raising children and picking up children and all the things and being perfect and skinny and beautiful. But that is ridiculous. And yes, I know, right? My sleep schedule, that is my ideal sleep schedule too, 2 a.m. to 9 a.m. I would love that. So, but I've been forcing myself. I got a sleep mask. That sounds so basic, but it has really been helping actually. So sleep, lowering stress, which is, easier said than done, but like give yourself permission and grace to, get rid of toxic people out of your life if you need to, and, welcome in more community and happy people. But these GLP-1s are a perimenopausal, menopausal, and andropausal for men, their best friend, truly, and can be at various doses. You don't have to have 100 pounds to lose to benefit from these medications at low doses. And so it's especially when you combine them with your hormone therapy. And then I always recommend getting thyroid checked. Almost everyone I see could benefit from some thyroid hormone boost, which helps with weight gain a lot. Because as we age, thyroid hormone falls. As we age, our hormones fall. Hormones severely impact our ability to process sugar. And so it all kind of comes together in this perfect storm of I'm gaining weight and I'm not doing anything differently. And I'm going to my doctor and my doctor's telling me, sure, sure, you're not doing anything differently. And they're just, basically looking at you in an accusatory fashion. And you're like, I swear, I'm not eating anything.
Well, it's interesting. I came across this study that was saying depressed patients. So they were losing a lot of visceral fat, but
Yeah.
sorry, they were losing a lot of subcutaneous fat when they examined them, but their visceral fat was going up because of cortisol. Cortisol increases visceral fat, and that's the dangerous one that you want to avoid, right? So GLP-1s significantly.
GLP-1s are target visceral fat.
Yeah,
specific.
exactly. Exactly. So, is there anything else that patients can use to help with both visceral and subcutaneous fat besides GLP-1s? Is there anything else, any other peptides that you can think of, or other therapies, other supplements, maybe vitamin D or vitamin K? Are there any other ones?
Vitamin D3, K2, almost everyone is low in vitamin D3 and K2. You want to take those together. K2 makes the calcium deposit in your bones where we want it, not in your heart as calcifications. Magnesium is great. Almost everyone's low in magnesium. If you're on a GLP-1 and experiencing constipation, try magnesium citrate. That is your friend for constipation on a GLP-1. Take that at night, full glass of water. There's things like creatine and can help with muscle mass. If you're low on testosterone, you can try boron. Boron will help raise, it can almost double free testosterone in a week. And it's also great for bones and for men. If there are any men out there, it's good for prostate health. So, um, glutathione decreased my, I don't know, what is that? Oh gosh, we have a lot of these. Um, but there are, once you get a little dialed in on your diet and lifestyle, adding in something like sermorelin or some of these growth hormone releasing peptides, I think can help you retain muscle mass. In addition to adding testosterone, I think that's been really huge. But I've been doing CJC 1295 and um, ipamorelin, a combination there to help increase growth hormone, mainly to help my sleep at night, but also for to increase muscle mass. Because as we age, it's just harder to hang on to muscle mass. And the more muscle mass we have, the better and faster our metabolisms are, which is why it's so important on any weight loss journey to get your protein and lift heavy so that your metabolism is better when you get to your goal weight than it was before. Because you can lose weight on GLPs without doing that, but you'll be skinny fat at the end and you'll get it all back. So we don't want that.
So let's go back and talk about hormones. I know we touched on it in the beginning, but hormone fluctuations, they're a big part of aging. How do these hormonal imbalances affect our health? And what are the best approaches, including any peptides or hormone optimizations that we can use to combat these fluctuations?
So the first thing that we typically notice, right, as we get into perimenopause after 35, I talked a little bit about is lowered progesterone. So we're not ovulating as often, so we're getting the insomnia and the the anxiety that goes with that. So replacing that with your oral micronized progesterone at night is fantastic. But what also happens, right? Sometimes you have the lower testosterone, especially if you've ever been on the birth control pill, that can lower your testosterone permanently for the rest of your life. So get yourself checked. If you're low, don't be shy about replacing. But these can all three hormones, testosterone, progesterone, and even an estradiol, all are going to affect our libido. And that's where I feel like a lot of women come in and they're just like, I don't feel like myself in mood, in energy, but also I'm not interested in sex like I used to. And this is affecting my relationships, right? Um, but when you don't have a libido, it's more than just the sex part. I feel like when I was on the birth control pill, I had no libido because it took my testosterone to zero. Um, and it affected, it was more than not being interested in sex. It affected like my confidence and my sort of mojo and how I presented in the world. And so I think there are, besides getting on testosterone, getting your hormones replaced, finding, an alternate form of birth control if you feel like synthetic hormonal birth control is affecting you negatively. Um, we love a good vasectomy. Um, but there's also things like PT 141, which are just amazing for women's libido. They work, men have all kinds of things like Viagra and Cialis and Trimex and all these things that help them with their sexual function. And there's very little for women to help us with sexual function besides hormones, which they do help, but we're a little more complex because I don't know about you guys, but like for me, it's more arousal is more in the brain, and that is where PT 141 gets in. Yeah, right. So it helps with that part. So the hormones, you've got estradiol and testosterone and progesterone. And I say progesterone too, it helps with libido because you don't want to have sex if you're can't sleep and you're anxious. That's what low progesterone causes, right? So I'm like, I think all three hormones are involved in libido. But PT 141 helps in the arousal center of the brain. And I love it too. I do it too. And I think I talked about this a little bit last time because the first time I tried it, my partner was like, are you like, he was like worried that I would take it because it takes about 4 hours to take effect. So I was taking it like earlier in the day and he thought I was going to be like out and about on this drug and like feral out in public. And I was like, no, 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 no. Like, that's not how it works. It's like,
Jonathan.
I was really funny. I was like, no, I felt totally normal like myself. And then it was later, I know when we were together later just by ourselves, that's when you notice, like when you're actually engaged with your partner is when you notice there's like a increased um, sensitivity is what I would say, is what I would notice. Is that, has anybody else used it and noticed that it's an increased kind of,
Who's going to come forward about that? But maybe
I
this is
know.
a good conversation. I love that we're just going down different rabbit holes and we talk about it. And that's what this community is about. Um, can you touch on how PT-141 works? It works on the dopamine receptors, but how it's different than, the Viagra, the Cialis. It's not a vasocongestor and
Right.
what you
So yeah, so Viagra, Cialis, those are working to increase blood flow, right? And so and I actually take Cialis as well. Like micro, I took a small dose of that a few times a week to increase blood flow to the area. I researched it and it can work for boosting women's libido and sensitivity, not as much as for men. But I also read that it can help you get a better pump at the gym. So it's helping improve blood flow so you can lift more weight in the gym and it's improving blood flow. So it's going to help with hair growth. So I was able to get on a little bitty dose of Cialis every other day for that. And I've noticed that's helpful. But PT-141 works in the brain on the arousal centers of the brain. So it doesn't deal with blood flow. It works on a totally different pathway. It actually incidentally works for men as well. So if your guys are wanting to order it too, you can, I always say couples that do peptides together, do well together. Don't let just one of you, do experiment with these. But yeah, it works all in conjunction and but it's one of the I think it's one of the only ones that is actually yes, my partner loves PT-141 too. We both do. Um it's one of the only ones that is approved specifically for women, but of course it happens to help men too, so that's great. But it's hard to get into the brain. It can also sometimes give you a little bit of a tan and a little bit of an appetite suppression, but not so much. Yeah, but mainly it's
the Barbie. It's the
the
Barbie pep.
Barbie peptide. I know a little bit, yes.
Sally, you're really passionate about thyroid. Maybe we could
I
start talking about,
am.
yeah, let's talk about thyroid a little bit. It's a critical part of maintaining energy and metabolism. How do you address thyroid optimization in middle-aged individuals, and why is it so important for overall health?
It is so important. So the thyroid gland, you guys, is this butterfly-shaped gland that is right here under your neck. And it basically it controls every cell in your body. Every cell in the body has receptors for thyroid hormone. And so as we get older, we have less and less of this thyroid hormone that is available for use in our body to fuel the cells of our body, give us energy, grow our hair, give us a mood, cognition. One of the things in Dr. Bredesen's book about dementia prevention is optimizing thyroid hormones. So one of the saddest situations in medicine right now is how conventional medicine is dealing with thyroid care. So they're using conventional ranges, which allow TSH to go up to, as high as 6 or higher, and they say you're normal, which you can't lose weight. If you have low thyroid function, losing weight is virtually impossible. And it also affects the brain and the mood. So you will have, depression, brain fog, anxiety. You can also have things like infertility and even miscarriages, right? If you have not enough thyroid hormone, you cannot support a pregnancy. And this drives me crazy because I've seen and analyzed labs for coaching clients who are in their 30s trying to get pregnant. And I'm like, your doctor told you that this is an adequate amount of free T3, which is the actual free thyroid hormone that is active in your body that endocrinologists do not tend to test for. They typically just tend to test for TSH, which is not a thyroid hormone. It's the signal from the brain to the thyroid asking it to make more thyroid hormone. But sometimes as we get older, or if we're under chronic stress, the brain just kind of gives up and it doesn't ask for more thyroid hormone. So if your doctor's just looking at a TSH, they're going to miss low thyroid function. And if they're not even looking to test your actual thyroid hormone levels, free T3, they're definitely going to miss it. So you want to go to a functional medicine or a doctor who will do a full thyroid panel, TSH, free T3, free T4, reverse T3, and both Hashimoto's antibodies, TPO and TG, because 90 something percent of low thyroid function is due to autoimmune disease, right? And we can get that under control by getting rid of gluten, cow's dairy, doing, low dose naltrexone, all kinds of other things. Because if you've got an autoimmune disease attacking your thyroid is slowly being destroyed over time, and a lot of patients don't know that. And they're like, my doctor never told me if I just stopped eating gluten and dairy that, or one or the other, that I could hang on to my thyroid gland, and now it's Swiss cheese and destroyed, and I can't lose weight, so I don't have to be on medication for the rest of my life. And most doctors, conventional medicine, just assume that patients are not capable of making those changes, or that they just don't want to, and they just don't give them the information. I don't believe in that. Um, there's
Are there
home
any
ways.
peptides? I always love to ask, are there any peptides that could assist the thyroid? And
Yes. In fact, so what we're seeing is that often patients who are being treated for thyroid, we have to monitor them when they begin GLP-1 treatment, because as the metabolism heals on GLP-1 treatment, they often need a dose adjustment downward on their thyroid medication. So if you're out there, you're on thyroid medication, you're optimized, you're feeling fantastic, you started GLP-1, and all of a sudden one day you start feeling like heart palpitations, you're sweating, you're feeling a little bit of anxiety, and you're like, what is going on? Call your thyroid provider and say, hey, I started a GLP-1. I'm having these symptoms. Do you think I might need a dose adjustment downward on my thyroid medication? Because sometimes when you lower that inflammation with the GLP-1, and your metabolic labs start to come into optimal range, your thyroid doesn't need as it starts to it doesn't you don't need as high of a dose of your thyroid medication, which is super exciting. So that's one thing that I've really seen. But you can also there are nutrient deficiencies that lead to low thyroid function. Being vegan and vegetarian is a big one, unfortunately, because you're going to be low in, iron, zinc, selenium, iodine, omega-3s, but you can supplement. So if you're on one of those diets for whatever reason, mad respect, but make sure that you're looking up the nutrient deficiencies that go along with them, and make sure you're getting and supplementing with those so your thyroid's getting what you need. Low stomach acid is another reason we might not be absorbing the nutrients that we need for our thyroids. So as we age, stomach acid falls, and stomach acid also falls incidentally on GLP-1 treatment. So I always recommend getting on something like Zypan from Standard Process that contains both a digestive enzyme and something called betaine HCl with pepsin. Has anybody used that before to help you boost stomach acid? And it helps you absorb your nutrients better, especially protein. So this one's big. So you take this supplement after the first few bites of each food. But boy, it makes a huge difference. Like when I was super hypothyroid, I would bloat with every meal, especially protein. I started taking that betaine HCl with pepsin, flat stomach again, no more bloating. And all of a sudden I was, able to absorb my nutrients because I was taking all these expensive supplements, and then I would get my labs done. And it's like, well, my vitamin D is still low. I'm still anemic, all this stuff. Well, I wasn't absorbing it because we can't absorb our nutrients without adequate stomach acid. And so a lot of people think, oh, I have reflux. That means I have too much stomach acid. It's actually the opposite. We don't have enough stomach acid. Food just sits there and then it kind of comes up. So what we need is adequate stomach acid to get through and absorb the nutrients.
I love that you bring nutrient deficiency into this because a lot of our symptoms, anxiety, depression, they are
Yeah,
hallmarks of nutrient deficiency. Can you touch on that a little bit? Especially patients who are on GLP-1. I find that, they're not eating as much, but then they gravitate towards foods that they just, the Doritos, the bag of Doritos. And now it's
no.
like that satiated them for that time being. Touch on nutrient deficiency because it's so important. So
Yeah,
important.
if you're on a GLP-1, you've got to focus on nutrient density, or you're going to end up with hair loss and muscle loss, and your skin's going to look terrible. Like you've got to give yourself the protein, the collagen, the nutrients that you need. It's just not, it's not going to end up. It's not going to be a good look in the end. But um, what was I about to say? Oh, I was going to say you guys offer the B12 injections, and the
Mhm.
first thing I do is always go look to see what kind of B12 it is. And you guys, they offer the methylcobalamin. So this is the high quality B12. So I was glad to see that. That's the methylated kind. That's the one that I always
And
recommend.
now
So,
it's available in 45 states. So
yay! That's awesome. So that's a great one.
yeah.
If you're experiencing a little bit of fatigue, that can be a really big one. Um, I mean, I could go through my favorite supplements that I kind of wouldn't go without. I have a whole supplement closet like Brian Johnson, that guy who's the don't die guy. But I would say like my top ones are a multivitamin with methylated Bs, pro-resolving mediators, those anti-inflammatories, like specialized pro-resolving mediators, magnesium citrate, because I have constipation, and but also any, magnesium glycinate is great if you don't have constipation, any magnesium. Um, and then the Zypan or anything betaine HCl with pepsin and digestive enzymes. That's really huge. And then anything else you're low in. So I'll take zinc, selenium, iodine. I am anemic, so I take proferrin, like the iron supplement. Those are big ones. There's so many out there, but I mean that's what I do in my coaching practice is I basically help you figure out what labs to request from your doctor, and then I help you analyze them, and we figure out what nutrient deficiencies you're dealing with, and then how to fix it with diet, lifestyle, and supplements. And
Now, on that, are there any peptides that support nutrient absorption and improve the body's ability to
I
utilize
mean,
vitamins, minerals?
I think BPC 157 would indirectly because it's going to improve gut health. And so, if you're working with a patient who is trying to eliminate gluten and dairy and things that disrupt the gut um, barrier and that are that's leading to inflammation, you can, sometimes it takes a little while for them to get that stuff out of their diet. So, getting on a BPC 157 can help them kind of bridge the gap and help them heal the gut while they're eliminating those foods that are the root cause of the issue. But
Wow, I see Jonathan is on too. He heard PT 141 and he loved
I
it. I love it. Jonathan is that's actually how I met Sally. Jonathan's the CEO of the Direct Selling Association, or did I say that correctly? Yes.
know, momentum factor.
Yes, there you go. And Momentum Factor, one of our vendors. So he's like, you got to talk to Sally. You guys will geek out on longevity. And I'm so glad I met her a year ago, and it's been friendship since. We have a few minutes, and I want to address some of the Q&A questions here
Yeah.
that are coming in the chat. Someone asked, could you speak about NAD, please? And then someone else asked about methylene blue. So thoughts
Oh, I
on
just started methylene blue. Yeah, so I love it for I mean it's anti-inflammatory. It does all kinds of things. It helps with UTIs. Um but I'm using it for immune system right now and for inflammation, and I have been around two very, very sick children for 2 weeks now, and I have not gotten sick. And so we'll see. I mean, I will pick up this time of year, I tend to pick up whatever is going around. And so I'm just like crossing my fingers because I have so much going on that um, I hope that's the case. But methylene blue, the Biopharm, Biopharm brand, it's on Amazon, is the one that was recommended to me by my doctor. It comes in a dropper format, and they recommended 20 drops a day. You dissolve it in water, and then it's super blue, so it'll turn your mouth blue. But the hack for it is to dissolve, get your vitamin C, get a vitamin C capsule, put vitamin C capsule inside of it, wait 10 minutes, stir it up, and it basically makes it clear again. There's a very light blue tint, and then you can swallow the whole thing without turning your mouth blue, but it still turns your urine a little blue. So it turns back and it has the same effect, if not better, with the vitamin C inside. So um, that's exciting. NAD plus, we love for the energy boost. I mean, that is what I see most patients taking it for. I just heard someone say that it's helping them with their anxiety. Um, in One of my medical colleagues uses it when she doesn't sleep well or when she's traveling. She'll wake up and do it, and she's got like a busy day. It's something that's really, really helpful for her. Um, let's see. Hmm.
If you have any questions for Sally, please drop it in the chat and we'll try to get to it.
Glutathione decreased your constipation. Fantastic. Yeah, I
Uh,
just started glutathione too. But I'm really interested in the injectable form that you have. I started the spray. Let's see. Zero libido. How many of these peptides can we stack? That is my kind of question. I'm like, so if one is better, if one is good, can we not stack a bunch of them? So be careful if you're a man because stacking a bunch of them could end up with priapism. So don't do that. But for women, I mean, I do. I take my testosterone, my estrogen, my progesterone, my PT-141. I don't take it every day. PT-141 is a special treat every once in a while. And then I'm using my low-dose Cialis about every other day, about 3 to 5 milligrams. Everyone's going to be a little bit different. Cialis has tends to last about a day and a half, so that's why I don't do it every day. Um, so I do it on workout days because it does give you that extra pump at the gym. And
Asked about the Wolverine stack. It's going to be an injectable, guys.
the Wolverine stack is an injectable as well, and I'm just injecting it on workout days, so 2 to 3 days a week. But when you look up how they're supposed to be used, it's supposed to be really daily or twice daily for 4 to 6 weeks, and then you cycle off of it. But I am on a budget, so I am doing it as much as I possibly can, and I'm still seeing really great results. So that's good if you're on a budget as well. Like just get it, try it, and see because I really noticed a difference in my
Our
shoulder.
protocol for three times a week. And guys, just so you all know, you can put all of these things in one syringe. So you could just dedicate maybe touch on that.
Yes, you can. And that makes it helpful. Yes, birth control and loss of libido. That is so true. I feel like I need to do a whole podcast on birth control. Not that I'm opposed to birth control, I'm just pro women having all the information, right? And not being told that they're crazy when they come in and say, I don't feel good on this. Love PT. What about hysterectomy? So, hysterectomy is depending if your ovaries were removed, you're in menopause immediately upon having you're having a hysterectomy. Even if they leave your ovaries, it turns out though, you're going to go into menopause sooner. There's something about the ovaries, they detect that the uterus is gone and they start to they wither and we tend to go into menopause a little sooner. So get on hormone replacement therapy as soon as possible. Ask your doctor proactively about it. It's so important to protect your bones, your brain, your heart, your urogenital tract. One of the most common causes of mortality in older women, besides breaking a hip with bone fracture and osteoporosis, is actually UTIs that go systemic due to loss of estrogen and not having enough estrogen, estradiol on board. Okay, increased sensitivity. Having an orgasm is challenging. Yeah, sometimes. Yeah, which is practice makes perfect, right? Well, let's see. PT-141 is sub-Q, not IM. So, and nasal spray.
Sorry, can we for anyone who's just started their GLP-1 journey, whether it's microdosed or they're using it for weight management, this is a question that keeps coming up over and over. How long should I be on these medications? You do a great job answering this.
So on GLP-1 medications, they're approved and we have 20 years of safety data on them. And you can be on them for the rest of your life. In fact, I would love it if a lot of my family members were, especially microdosing. So you have options, but you don't have to be, right? These are peptides. They can be cycled, they can be personalized. And I love that because we all react differently to these peptides. We have different bodies. And different underlying disease states and ages. So, right, if you're using them to lose weight, you might need to get up to a higher dose to reverse the metabolic damage that was done, right? To heal your metabolism, get your blood sugar down, reverse type 2 diabetes. Um, and then once the metabolism is more healed, you might be able to come off the medication entirely and then maintain on a low carb diet. This is high good fat, high protein, rest of your life, right? We can't go back to what we were eating before. But you can also stay on a low maintenance dose. A lot of patients are doing that. And these are, some patients will do a low maintenance dose weekly. And this is typically like 0.25 to zero point 0.5 milligrams, right? Like kind of startery doses. And you could do it weekly. Some do it every other week, even monthly. There are some people who do it as needed, right? They're like, I'm doing great with my diet and lifestyle, but around the holidays, I went down a sugar rabbit hole. Now I've got cravings. I need to get out of that. So they'll do another cycle. You can do that. And it becomes so much more affordable when you're cycling it, when you're able to minimize the dose. We want to find the minimal effective dose that helps you maintain your weight loss. And you can definitely do that. We just don't see a lot of side effects doing that. In fact, we see so many gains That's the number one reason people want to stay on it isn't even the weight loss. It's the inflammation. It's the risk of death has slashed their that inflammatory marker, the high sensitivity C-reactive protein. That gets cut like in half even before patients have lost any weight at all. And that's risk stratifies patients for a risk of cardiac event, stroke, and dementia. And I see so many patients in the highest risk category of that. So yeah, stay on it if you want, but you don't have to. Yeah.
Well, I'll answer. I'll ask my own question. I noticed while I was on tirzepatide, I started like it didn't happen early on when I was on the medication, but as I was on it for a very long period of time, it started giving me a little bit of anxiety. I was starting to feel blue. So I switched off of the tirzepatide, and I was doing all sorts of things just to double check to see, I was approaching it as a scientist, right? Is there a
Yes.
correlation? Is it a causation? Like, what is it? So I got off of tirzepatide, I switched to semaglutide, and I'm back to normal, right? I feel great. So do you see that with other patients? Do you see that it starts affecting your chemistry or because it does affect your dopamine and your reward pathways. What
Yes.
are you seeing?
It does. It's really interesting because you'll see a little of both, right? So it reduces neuroinflammation. So for some patients, like ADHD patients, they're like, oh, I don't need my Adderall on this. Or some patients are like, I don't need my SSRI. But then for other patients, right, if you are relying on certain foods to hit your dopamine pathways, if you're no longer craving those foods and that's not no longer a source of dopamine, you can get a little blue for a while. And then as you're changing your diet and lifestyle, you're lowering carbs, lowering sugar, your blood sugar's coming down, but it takes a little while before your body can learn to make fat for fuel and make ketones. So you can have a little bit of the blues and a little bit of fatigue too. And then once your metabolism, usually we'll see this in labs, right? Insulin will still be a little higher. And we see a little uptick during the holidays. From October to January, I see an uptick in these kind of symptoms because we get, even with our best efforts, we still get added sugar, and that starts to mess with our mood and our blood sugar regulation and everything, and our sleep. And we're traveling, and so we've seen. I've that's probably the number one, complaint that I've had in the last few months is in that it's always this time of year. It's just a hard time of year. But yeah, it can affect dopamine signaling, and it's really interesting. And I don't think we know every patient responds differently to these medications. It turns out for alcohol use disorder, semaglutide is more effective than tirzepatide, which is so interesting. So if you're dealing with any sort of addictive behaviors, that maybe semaglutide is for you, and isn't that nice because it's less expensive. But then some patients just swear by tirzepatide and just feel that that's the one they that really gets them the results. So everybody's a little bit different. But I'm so glad. I love hearing that. I love that you're doing your own science experiment because it's so true. Like, who knows why you could have been affected differently, but if you can go back to the less expensive one and get results, that's fantastic. And it probably is a testament to all the work you have done personally on your own diet and lifestyle that you can probably get the same results with a lower dose, go back to semaglutide. And this is what I see as people, as their metabolisms heal on these medications. It's not as if they have to continue to increase their dose and they max out and they're done, right? As you heal, if you're changing diet and lifestyle, like you should be able to maintain on a lower dose because you're more healed from the inside out.
So Sally, I'm getting my labs done next week because it could be a micronutrient. That's why I asked about the micronutrients. It could be an issue with micronutrients. It could be hormones. Who knows, right?
Yeah.
For people who are on this call, what lab work should they ask their doctors for? Because we don't know. Like, what should we ask them? They give us the standard protocol. What would you suggest? And then afterwards, I could come to you to analyze it.
I know exactly. Well, for
But
your
tell me I'm going to take notes. Go ahead. What should we all?
definitely get your progesterone checked. You want to get that done 7 days before your period if you're still cycling. Get your estrogen and testosterone checked on day 3 to 5 of your period. Um, but then you're going to want to look at nutrient deficiencies. If you're a young, healthy cycling woman, check out your full iron panel because that kind of anxiety, heart palpitations, that can be thyroid, which I think I already mentioned the full thyroid panel, free T3, free T4, TSH, reverse T3, and thyroid antibodies, TPO and TG. That's going to be important for mood. That's huge for mental health, actually. So getting a full thyroid panel. But ferritin and iron also affect your thyroid, which also affects your mood. So when you're asking for, hey, check my iron, they're going to say, here's your CBC with hemoglobin hematocrit. That's not enough. So, yes, you want a CBC, complete blood count with autodiff, but you also want your serum iron, percent sat, TIBC, UIBC, and ferritin. And you need all those to get a full, complete picture of your iron. And this is so important because your iron can be high due to inflammation in certain areas, or it can be high due to genetic hemochromatosis. That's a different combination of all those iron labs that I just told you about. Or you could have anemia, but it may be, subclinical. You may not be able to catch it unless you get a full iron panel that I just mentioned to you. So there are so many labs that you could get, but I would say full hormone, full iron, full thyroid panel. Those are big. Yes. And then
Anything else? No.
B12, D3. Um, you can get if you feel like you're having like dragging in the morning, dragging yourself out of bed in the morning, you can ask for a morning cortisol test. Sometimes we have a little adrenal fatigue going on there. What are some other favorite ones? Get a lipid panel if you feel like you have any history of of high triglycerides, especially. And it's good to track while you're on a GLP-1 anyway, because we want to make sure your triglycerides are coming down and your good cholesterol's coming up. Get your fasting insulin. That's a big one. I always like to track that one. They'll probably order a comprehensive metabolic panel that'll have your glucose. And then, oh, everyone should be asking for high sensitivity C reactive protein, CRP. It's called HSCRP. That's the one that's your risk of death one that is like slashed in half on a GLP-1 even before you lose weight. That's what we call a non-scale victory. Love that one because it's really great because I don't know if you guys have this experience when you start a GLP. I have tons of coaching clients. When you start on the low doses, like often you don't lose weight for the first couple months, right? You have to get up to the higher doses. The inflammation has to come down, a lot of times. So weight loss can be slow in the beginning, but what's not slow is the changes you see in labs. And so getting your doctor to track those labs for metabolic labs, you want to get lipid panel, comprehensive metabolic panel, insulin, ask them to do leptin, HSCRP, HbA1c. That's your average blood sugar over 3 months. Another fun one to get. Um,
Well, I'm coming. I'm coming for you, Sally. And so share with us as we're wrapping up, share with us how we can find you after we do our labs. How can we find you to come
so
analyze our labs and tell us?
it is. It's really fun. It's like getting your tea leaves read or your astrology tarot cards read, except for it's labs and it has real relevance to your life. So the best way to find me is probably on Instagram at Sally Doll Sykes. I'll put it in the chat.
Yeah, Brenda put it in already. She's
Oh
like,
yeah.
look at that. Good job, Brenda.
I
Go
did.
follow Sally.
Oh,
She's
she put it
awesome.
in there already. Okay, at Sally Doll Sykes. And then if you go to Instagram, there's a link to my link tree, and that'll take you to my like YouTube and my podcast and my all of the things. But yeah, I try to do a lot. There's a lot of free coaching content in there that because I know not everybody can afford to work with me directly, and so there's so much that you can learn just by you know watching and reading and
And we'll also put in the show notes all the recommendations that you just gave as far as lab requests. Yeah, we'll put that in. Um,
good.
well, thank you so much. Someone asked you order lab work for people.
So no, what I do is what I like to do. I'm very practical. Well, I'm a health coach, not a doctor, so I can't order labs myself, but I can do two things. I basically create what looks exactly like a lab order, and you take it to your doctor and you say, order these labs. So it has all the codes and all the insurance codes to get it covered. So I basically make it super easy for your doctor to do what we need them to do, because the first thing we want to do is go through insurance that you're already paying through the nose for. So if that doesn't work and you have a doctor who's like, no, I refuse to order labs, which sometimes they get pushed back, but we try to get them to order as many as possible. There are places, there's a self-pay cash lab that I refer people to that you can just order your own labs yourself, whatever they won't order. And it's cash pay, it's pretty low cost, and they send you to LabCorp. And it's great once you get your results and you show how relevant they are to your health, you take that back to your doctor. Now he'll order the labs for you, or she'll order the labs for you from now on, especially once you show that you're having results on whatever you're doing. But yeah, I try to get everything covered by insurance and ordered, through your doctor first. So that's one of the things I help you talk to your doctor and get them to do their job.
We love that. Thank you. Thank you for helping us and educating us and shedding light on some of these topics that our doctors don't tell us about and they don't share the information. So thank you so much. I hope all of you enjoyed our conversation with Sally. We'll see her back very soon. Thank you, thank you, thank you so much, Sally. And thank you, all of you, for being part of this community and joining us for another weekly educational series. We love you all so much. Thanks.